We just want to give you a good introduction of how to put the regulators onto the different kind of oxygen tanks. This oxygen tank is a medical oxygen tank. It takes a medical fitting. It also takes a prescription to get this, but this is just the common oxygen tanks that are available. This is an industrial oxygen tank that has pure oxygen in it also. So it depends which kind of tank. These you can get without a prescription at a welding supply place. It just depends on what kind of tank you're going to use, which then dictates what kind of regulator. These are both pediatric regulators because the oxygen coming out has to be slowed down. This is the industrial pediatric regulator. We're going to put this on. Your gas is turned off, of course. That slides in, tightens up, goes clockwise. And then we need to take a wrench and make sure that's tight so no gas leaks. Now I can open up this tank and it then registers that there is oxygen in the tank, and then I can adjust this to show that there is per liter being released out of this fitting here. So right now it's at 1/8. There's 1/4 liter per minute. This is the medical tank regulator, pediatric regulator again, so we can throttle it way back down to 1/8 or 1/4 liter per minute. This is pretty easy to go on. This unit's turned off. There are 2 pins here. You have to make sure those 2 pins slide in, and then you tighten that down. At this point I can open my oxygen. Again, you'll see the regulator indicates that there's oxygen there, and then I can adjust the flow and speed that I want coming out of the nozzle. Now to that nozzle I will hook up my tubing that will go to the ozone generator. In this case it's just a small one. What we're going to do is a real simple explanation of how you'll hook up the ozone device to your oxygen tank, and then how you're going to fill the insufflation bag and then use the catheter. So let's start with that. This is the unit that we're going to use. It's fairly simple to, it just plugs in to a normal outlet and then plugs in, and you can see the power light is on. And we're going to set our oxygen at 1/4 liter per minute. That gives a pretty good speed, and you'll see this, but it also gives us a 33 micrograms per milliliter setting. So I will set that at 1/4. And now what we're going to do, there is oxygen coming out here. It's hooked up here. There's oxygen coming out. I'm going to turn on the ozone machine, and it'll take a few seconds to get the ozone coming, but I can smell a little bit. I'll tighten that on. Now what it's going to do is it's going to fill this bag. 200 to 300 milliliters is a good amount for a rectal insufflation, and we'll just watch that fill up. It'll just take a few minutes. We also have the catheter. This is a 14-inch long, and it has a special fitting on it. That's a lure lock, and that fits right to the bag. So you can see the bag filling up. And if I really wanted 200 exactly, I could pinch there, and that would allow the bag to fill up just to 200. I'm going to let go. When I know it's at 200, I can turn the machine off, and I'll turn my gas off, and I can shut the clamp on the bag. Now the ozone is kept inside the bag. Now we'll take the catheter, and we're going to hook that up to the bag, and you're going to want to lubricate the end here with some KY gel or some aloe. Some use olive oil, but some kind of lubricant. And when we're ready and we're in private, we'll take 4 to 5 inch hold on it like this. I'm going to unclamp, and I will take that and make sure that gets inserted. And you can feel it up in there. You can put it in 6-8 inches if you want. And then I will slowly move the catheter up and down a little bit, and you can feel it'll open up, and all of a sudden you can move all this gas into the colon. Okay, I'm done. I can pull this out. I can easily unhook it and set that aside. This will be dirty. You can take some toilet paper and wipe that off, and you can throw this out, or if you want to, it can be reused. Alright, so I have the catheter here, and it might be a little discolored here. So the first thing I'll do is I put that right down into the sink, and I turn the water on and I give it a little bit of a flush. Now while the water's running, I pull up water into my syringe. This should be with your kit. And with that end down into there, I can now push nice and hard, and it blows everything out and cleans that out. Alright, now the next thing I'm going to do is I'm going to take a little hydrogen peroxide, just inexpensive, and pour a little bit of that in. I'll take my syringe, draw that up, and I'm going to hook that up to the catheter, and now I slowly push out, and you can see it coming out of the holes there. And hydrogen peroxide will eat up any organic materials, and usually I'll just let that set then for 2 or 3 minutes. So let's say the 2 or 3 minutes has elapsed. I'll get rid of my hydrogen peroxide. Again, I put this down in, do the same thing. So I've got water flowing through it. Drop some water there. It's all flushed. It's all clean. That's clean, had water in it. I'll take toilet paper and wipe it off again. Usually I'll just take mine and put it like that, and just to absorb some of the moisture, I'll wrap that. And if you have a sandwich bag or whatever you want to do, I just take that, put my name on it if I need to, if my wife was there, so we know which one is which. And I put that along with the bag into the area that I use, and that's it.